Bloating, cramping, diarrhea. These symptoms can strike when our body reacts negatively to something we've eaten. Some may dismiss this as irritable bowel syndrome, but that may not be the case. We find out more in today's Health Matters. It can strike at a moment's notice: cramping, sweating, a twisting feeling in your stomach after eating something that your body just doesn't agree with. For those with irritable bowel syndrome, the feeling doesn't seem to go away.
IBS really is someone who has those particular symptoms rather consistently. Everybody sits bad with a meal now and again, but this is someone who, especially when they get a bad meal or something, then they really have a lot more symptoms. And part of that is related to what we call visceral hypersensitivity.
This simply means there's a heightened sensitivity inside the abdomen. Dr. Bays says IBS is often mistaken for other problems.
I think the most important aspect of irritable bowel syndrome is that it is a diagnosis of exclusion, which means you got to make sure you don't have something else first.
IBS is defined as a hormonal malfunction in the intestinal system. If you're an adult and experience consistent bloating and cramping, you should see your physician to determine the cause.
You see someone like myself or a practitioner that deals with irritable bowel a lot, they can give you hints on how to decrease the amount of bloating that you're having and cramping, and certain medications can be used and those sort of things.
85% of irritable bowel patients are women diagnosed during adolescence. Very rarely is it diagnosed in adults, which is why it's important to speak with your physician if you're dealing with intestinal problems. Reporting for Lee Memorial Health System, I'm John Bafar. Certain lifestyle modifications, dietary changes, and sometimes medications are prescribed for IBS.